I had big plans. I thought, I'm going to do Running Start. I'm going to be done with my first 2 years. And in 2 years, I'm going to be in med school. Right. And I had a really rude awakening when I got to the University of Washington and I was in 400 level classes. I think I was torn between being free from my home and hometown for the first time, as well as, having very challenging coursework. And I wasn't very successful. I didn't get competitive grades, but I did finish my bachelor's in biology. And at the same time, my dad actually became very ill when I was in college, and he actually passed away about a month after I graduated from college. And he was very sick for those last years of college. And I got a lot of exposure to the healthcare system. At the time, I was working in the healthcare system, volunteering and working as a patient care coordinator. And I was really impressed with his nurse, his critical care nurse that took care of him, at the end of life, the last month of his life. I just was so amazed with this complete stranger to our family and how just intimately involved she became with our family, and intimately involved she became with my dad, and taking care of him and just really caring about his survival, really. So I didn't go into nursing school right away. I worked in the healthcare field for a few years. I think I was still thinking I would try to go to medical school. And I think it was some female physicians that I was working with. They, interestingly enough, they were talking about work-life balance and family. And so they recommended nursing and maybe like a nurse practitioner path. I applied to the nurse practitioner program at the University of Washington twice. I felt like I met their minimum requirements, and I did not get accepted. And it was interesting because looking back now, I think my application essays were healthcare administration essays. They were like looking at, healthcare systems and how do you improve them for the greater good? And, how do you create umbrella programs for people coming into the emergency room that need resources in the community? So it's really interesting because I actually think I fell into, without really making it my goal, what I really want to do and what I really enjoy doing, maybe what I'm a little bit more fit to do.